Hello everyone, my name is Kyla Hecht.
I'm Tatiana Williams.
And I'm Anthony Lacudera.
We're doing our presentation on a prison nurse, which is also known as a correctional nurse.
The prison nurse's primary activities are assessment upon intake, primary medical care, physical exams, and medical histories. We also take a look at the dental health of our inmates, the mental health, substance abuse assessment, detox, and counseling. We have to perform physical exams and assessments because a large part of the population is indigent and has lacked any type of annual physicals. We have to assess for medication needs such as hypoglycemics and antihypertensives, also seizure medications. We also have to perform treatment for injuries from violence such as puncture wounds or dog bites upon admission. Medical services received by prison inmates are broken down to both state and federal percentages. As you see in the federal incarceration inmates, they are there for a longer time and they also receive a higher percentage of care at the time of admission. State is just a little bit below that. Since admission, you'll see that federal inmates also receive slightly more care than the state inmates. For mental health, we do a thorough assessment for any diagnoses that will require treatment or medications. We also assess for substance abuse, detox, and counseling if needed in groups while they are incarcerated.
Teaching and learning that can be applied to addressing the core population. Many inmates come in with diabetes and hypertension. We can provide teaching and learning about their conditions and what medications they should be taking, chronic illness management, relaxation techniques such as exercising, deep breathing exercises, group therapy, stress management. These people are locked up for 24 hours a day. They're going to be stressed. They can get violent. So we could teach them on ways to manage their stress just by talking to them and providing them with resources. Education and training. The education that's required is an LPN or RN license. A traditional nursing experience is preferred, but it's not always required depending on where you're going. Training. Additional training on safety and security is usually provided by the prison. They want all their workers to be safe. Fights can happen and emergencies can occur, so they want all their staff to be trained. You can also be certified as a correctional health professional, which will also give you the training that you need. Other professionals the nurse interacts with are other RNs or LPNs, law enforcement, deputies, police officers, pharmacy, correction case managers, social workers, supervisors. They interact with everyone who runs the prison.
Skills and abilities. For treatment, intervention, and triage, correctional nurses provide emergent, urgent, and preventative care, as well as education for their patients. They must also screen for lice, infection control, and TB testing. They must provide a safe and secure environment. They play a vital role of infection control principles. They also must control sharps and hazardous materials. They must provide safety and be aware of their surroundings and the facility layout. They're responsible to triage and care for the sick that are in and out of the prison. They're held to high standards as far as confidentiality and professional development. They must provide the minimal necessary information needed to meet the safety of their patients. For example, if a patient is epileptic and they need a lower bunk, they must get that for the patient without disclosing their medical history. Ethical and legal issues. They must treat the prisoners with respect and equally, no matter the reason that they're there in the prison. They must provide and equal care for everyone and advocate for their patient and their rights by using therapeutic communication and have a professional nurse and patient relationship with clear boundaries. Interesting facts: they decide if they want to know the crimes of their inmates. They may have the same patient for many years. They must be proficient in assessment of ears, mouth, eyes, and skin, and psychology.
In conclusion, prison nurses have a very physically and mentally challenging profession. They are dealing with a very unique population that is very demanding, manipulative, and violent. We hope you enjoyed our presentation, and this will conclude our presentation at this time.